Hello everyone, we are here in the Singapore Expo. It's the day before we go live and accept our first batch of patients, but construction is still going on. Our nurses are here working on the workflows. We're doing training. There's just many things that are happening at the same time, and all of us are all gathered here and trying to make this work and to be ready for tomorrow.
Well, it's been sort of life in the fast lane for us since Saturday, Sunday to today. Many of us, especially the nursing team, the ops teams, have been constantly up here to get the place ready.
We are expecting to see patients who have just been identified as a COVID patient, and they may or may not have symptoms, and we are prepared for the worst if they develop or some deterioration or very worsening symptoms. We are prepared to care for them, and if need be, we'll send them back to the hospital. In terms of training, the special thing about this deployment is that we do need to swap patients.
I guess at the end of the day, what we're trying to achieve is for them to be better, and that even though it takes one patient to be better at a time, which means we are going towards the journey of recovering lah. But slowly but surely we'll reach there. So it feels very rewarding somehow that they get to go back with their loved ones.
Well, it's been a long week of preparation, and as you can see from my background, this week has been very fruitful. I think that all the people that have come together, whether it's doctors, nursing, ops, allied health, pharmacy, I'm really very thankful for all the effort that you have put in, all the extra hours, the sleepless nights to prepare all the different equipment. There's also been a lot of help from external parties such as the CIF that came through with the comms equipment, IHIS, MOHT that came in with the telemonitoring devices and also the computer devices. I think we're ready. We've gone through many rounds of rehearsals, and we are expecting to receive the first patients later in an hour's time.
It's taken us 5 years to come to this point to build the Woodlands Health Campus. It's taken us 5 days to ramp up what we need to do to get this place up and running. Of course, we can't do this on our own, and it's very obvious that this effort goes beyond Woodlands Health Campus. It really is a Singapore-wide effort. We have nurses joining us from Sing Health, from the Skin Centre. We've got doctors coming from IMH, from also the Skin Centre, and beyond the healthcare. We've teamed up with the management of Resorts World Singapore to run this place. So it's been a very exciting time, but also very confusing because we are working with many different groups of people at the same time. It is quite obvious that we have the capabilities, certainly under Mohan's leadership. We do have a lot of the clinical know-how, our nursing know-how. Man, being an ED nurse, is very well suited to help us ramp up the operations on the ground. But really, this is something that we have been tasked to do for the sake of Singapore. So it's not just about us, it's about getting our act together and do our little part to help the healthcare and the COVID battle that we are in right now.
Keep yourself and your family safe. Hang in there. Don't give up. Not sure how long this fight will be, but regardless, let's support each other. Be nice to one another.
Yeah, it's been a long journey for all of us. So I think for us, just let's work harder together. Yeah, so after this, we can all have a good break.
Yes, and hydrate yourself, eat lots of vitamins.
Remember to wash your hands.
Work also work, but temperature must stay calm.
加油！